It's time to have the Real Convo, a show that brings hope and awareness to those affected by suicide and mental health. As someone who is affected by both, American Foundation for Suicide Prevention Southeast Florida board member Alan Mednick breaks the stigma with his mission that no one ever feels alone. With the help of influential guests in the community, the Real Convo starts now.
Welcome to Real Convo. This is Alan Mednick from the American Foundation for Suicide Prevention, and we're doing a podcast again. Still not able to get into the studio to do the recording, so we're using a new format I guess a lot of people are using out there, which is Zoom. So I really am excited to start doing these podcasts with Miranda Khan, who was a former news anchor. Now she's turned into an author, children's author, and also a mental health advocate. So welcome on, Miranda.
Wow, you make me sound like a really big deal. For a minute, I thought you forgot.
A really big deal.
You are. You definitely are. So Miranda has a special guest that we're going to have on today to talk about the coronavirus. And Miranda, do you want to give a little introduction here?
I will. I mean, the man, the legend. I mean, he is here. He is also my personal doctor, our family practitioner, Dr. Michael Sinclair. I've been going to him for years. We actually met when I was
when I delivered you.
Huh?
When I delivered you.
See, now you know why I love him. Wonderful sense of humor, a brilliant man, and I wanted to have him on. But again, I did want to disclose that he's my personal doctor. But everybody has all these questions about the coronavirus. There's a lot of misinformation getting out there. And so I figured, who better to ask than my own personal doctor who loves to nerd out on these things, and he doesn't take that as an insult at all, do you?
That's what I do.
No, I actually call him Data. For these Star Trek nerds out there, you probably know what I'm talking about.
I do. Like Data.
So you've been practicing medicine, as you like to say, as since dirt was actually discovered. But in all seriousness, I think you got your degree in 1985?
1986, I think, is when I came here.
Yeah. So you've been at it for a little while. Your brother's also a doctor. He specializes in infectious disease. So I just want to get right to it. The media has been getting a lot of criticism, a lot, as you probably know, saying that the media is hyping this up. They're inciting fear. We're not going to do that today. At all. We're actually going to go, I don't know, a little old school and go back to the days when the media just gave you information and let you form your own opinion. So that's what we're going to do today. Does that work for everybody?
That's what we want to do here.
All right. So I'm going to start with the obvious question because I still see people doing this on social media. Dr. Sinclair, is the coronavirus a hoax?
Oh no, this is very real. Coronavirus is not even new. It's old. It's been around for decades. We've had outbreaks before. We've had animals. This one's particularly what they call novel, which means humans have not had this particular strain, so there's no natural immunity. It's definitely not a hoax. There are people that are really getting sick, and most people actually don't get really, really sick. But 1 or 2% sounds like a low number when you're playing tiddlywinks. When you're talking about lives, it's a big number.
Well, and let's go back to that positive spin there, because you said most people won't. We've heard percentages as high as 80% of the population that gets the coronavirus, COVID-19, whatever you want to call it, will have mild symptoms. So there's a lot of people out there questioning, why are we doing this if there's only a 1 to 2% mortality rate and 80% of the population is going to be, for the most part, okay?
Well, it's a complex answer, but it's got a lot of parts to it. If we were talking about a trip to the grocery store in your car, and we said you had a 1 to 2% chance of never coming home, how many trips would you make to that grocery store? Probably none. So it's all in perspective. We don't really have a choice on this one. We can't not be exposed to it. It's everywhere. So we have to do what we can do. And there are things that can be done to minimize your chance. Now, the numbers keep changing depending on which experts you listen to or which lay people or which news media is talking about it. But roughly the numbers are as many as 25% of the people that are going to get this have no symptoms at all. And kind of remarkably, paradoxically, those are the dangerous ones because they spread it unknowingly. They have no symptoms whatsoever. They just become a carrier. They spread it. They're not immune yet, but they have no symptoms. There's probably another 25% or so that get mild symptoms like a cold. So it's not pleasant, you know, low-grade fever, sniffles, that kind of stuff, maybe a little bit of a cough. Not a really big deal. Then you get another 25% that get pretty hard symptoms like maybe the flu, because the flu is not a cold. The flu is a much bigger deal, the regular flu. You get a high fever and aches and chills and bad cough, and certain actually percentage of people actually die from just the flu every year in the United States, and has for years. 40, 50, 60,000 people die every year from just the regular flu. Now we have coronavirus. So what's different? Well, the other flus are somewhat similar to each other, and there's some natural immunity amongst the population. In this particular case, it's a completely novel virus, which means that humans have not been exposed to it before, so there is really no natural immunity. So why do some people get sick and some people don't? Well, it's individualized based upon your own immune system. The really disastrous changes occur not because of the virus, but because of your body's response to the virus. That's why certain medications seem to help. They knock down your response, and it's that response that can cause scarring of your lungs and permanent shortness of breath and all the other terrible things that happen. But again, trying to be sort of upbeat and have some hope here.
Yeah, I was gonna say we're waiting for it. That's what we wanted.
Most of the people are not going to die. There's going to be probably at least 98% of the people will survive. Of those 98%, maybe 10% of those are going to have some long-term problems, which are probably manageable. And we're getting better at handling it, but there's no antibiotic. It's a virus, so antibiotics don't work. We don't have any really good drugs. There's been some talk in the media about two particular medications, one called Plaquenil, also called hydroxychloroquine, another one called azithromycin, sometimes called a Z-Pak or azithromycin. There's been some very small studies that have shown that, at least in certain people, it works. But again, the studies were small. They were not really very well designed. A real study is actually going on right now. In about 4 to 6 weeks, I can have a better answer for you that what it does do, what it doesn't do, what your odds are. There's controversy right now. Should everybody be on it prophylactically? Should you put it in your system early at the beginning of the symptoms? Should you wait and save it for the people that are the most symptomatic? And the answer is we just don't know. And those two drugs are not entirely harmless. They can do something funny to your heart. They can make your EKG change and prolong something called a QT interval, which can actually stop your heart from beating. So that's kind of a problem. On the other hand, it does seem to have some promise. We're getting some feedback now from places that have no other choice except to use it, and people are getting better. I had one lady call me today. Her mother was on a ventilator until yesterday. They started the Plaquenil and Zithromax, and within 24 hours, she had a 50% improvement in her breathing. Wow. So that's real. And again, would she have had that anyway? We don't know. There's a lot of moving parts here. You need a study. A study is about the only way to tell, because when you make one little tweak in a human body with millions and millions of moving parts, it changes other things. So you just don't know. And the only way to really find out is to actually do the study. We don't really have a lot of time to do a study. So
how is it transmitted?
You know, that's another good question. It keeps on changing depending on who you listen to. At the moment, there's two kinds of transmission that are quite prominent. The first one is large droplets. And what that means, when somebody sneezes or coughs, big droplets of coronavirus land on things. They land on doorknobs, they land on the floor, they land on tabletops, and they can last from hours to weeks. And if you touch those things, you're not going to get sick from it by touching it with your hand. But if your hand then touches your nose or your eyes, possibly even your mouth, the virus can get into your system and then try to penetrate and start to multiply and get you sick. So it's not like you can't go outside. You can. You just have to be very much aware of what your hands are doing. If you're going to touch something, before you touch your face, clean your hands. The other big transmission appears to be people that are living with each other. So if you've got a mom, a dad, a couple of kids all living in one house, and one of them has the coronavirus, whether they're sick or not, they can be transmitting it to each other. And that seems to be an underreported way of actually transmitting this problem to each other. So the whole big bugaboo about testing is trying to find out who has it and chasing down the contacts of whoever has it to see if they have it, so we know where to direct the resources. The test isn't going to change what we do for you. It changes where we do it and how we do it and how fast we do it, but it doesn't change what we do.
So you had mentioned that it's actually more likely to catch it through your eyes or your nose as opposed to your mouth?
As a matter of fact, yeah, there's at least some theory that the saliva is somewhat protective, so you can inhale it through your mouth and that would get you in trouble. But if it touched your lips and your tongue and your cheeks and the inside of your mouth, it's likely the saliva or your stomach acid would kill it, most of it anyway, before it actually got to your respiratory system. This bug's a little bit unusual. It has a single place in your lungs that it binds to. It's called an ACE2 receptor. And that receptor is what allows the bug to get in. Once the virus gets in you, it takes over the machinery of the cell the cell starts to make duplicates of the virus, and then when it gets enough duplicates, it bursts and releases them, and then all of them penetrate other ACE2 receptors and does it again and again until you're overwhelmed. So that's how it transmits. So if you can keep it out of your lungs, you put on your hands all you want, it's not likely going to hurt anything. It's when it gets in your lungs, and the nose is a direct passage to your lungs, and the eyes, because there's a tear duct that goes from your tear duct into your nose, you can inhale it. That's why people, when they cry, they get a stuffy nose, because tears go into your nose and you inhale it.
That's really interesting. You would think that the mouth would be most people, I know I did, thought that you can't put it in your mouth. I would never think that the eyes would be.
I wouldn't put it in my mouth to test that theory.
No.
It looks like the place to avoid is your nose and your eyes for sure. And that's the issue with the face mask. People have this idea that the face mask is going to protect them. Not really. What the face mask is supposed to do, if you could, is to prevent blockage, prevent the virus from going through the face mask, but it doesn't really do that. The holes in these N95 face masks are 3 times as big as the virus, so the virus can pass through pretty easily. But it's not mostly airborne, it's mostly heavy droplets. What the mask is supposed to do is to keep your hands off your face. The trouble is sometimes people, when they're wearing the mask, touch their face to get the mask adjusted more often than if they just didn't have the mask on in the first place.
Yeah.
Really?
Somebody just recently released a cute little invention. It's a wristband that has a vibrator in it that knows when it goes up to your face, and it buzzes your wrist when your hand gets near your face. Kind of remind you. It's the same thing about the posture thing. You put it around your neck and your back, and when you slump over, it buzzes. When you sit up, it stops buzzing. So same kind of thing. They're about $50, and maybe some manufacturer like Apple will come out with an app that buzzes your iWatch, and when you get near your face, like your cell phone knows when you're near your face.
Like, I was thinking about getting a new watch earlier today. Maybe I'm going to put that down.
So the funny thing here is I got to itch my face, and it's driving me crazy because I know if I do it right now. So I gotta use my shirt right now and just
hand sanitizer.
Go like that.
And if you get some of this and you got an itch, put it on your hands, rub it in your hands, and itch your face all you want to. And don't touch it.
Quickly. So I
Here, put your hands up. Let me fix this.
I get an itch too. Like, I swear to God, when you say don't do it, that's when everyone wants to do it.
Yeah.
So Dr. Sinclair, let's go back. So Dr. Sinclair, I want to go back to this whole mask idea, because now they're talking about maybe everybody should have masks. There are companies now that are going to be mass producing masks. We keep seeing, Dr. Fauci, that's his name, right?
Mm-hmm.
You know what I'm talking about.
There is a point to the masks. It's probably more important, or at least equally important, that sick people wear them, so that when they do cough and sneeze, the sneeze and cough goes out 3 feet, not 27 feet. So having sick people wearing them is really important. And healthcare workers who are directly involved with patients that are sick, that's a whole different animal. When you're intubating somebody, putting a tube down their throat, and somebody who's coughing and wheezing and trying to struggle to keep alive, you're getting facial coverage with all sorts of coronavirus particles. So those people actually need the real masks.
And then,
but for the rest of us, it's mostly a block of your hands to your face.
And what about the scarves and the bandanas that they say that work?
Well, again, the same kind of thing is that you could probably honestly wear a Halloween mask and get most of the protection, because you're really trying to block your hands from your face, as opposed to trying to actually prevent invasion of the particles through the mask.
Makes sense.
Yeah, I'm so glad you brought that up, because they've been talking about scarves as well. You mentioned 3 feet versus 27 feet, so I think you know where I'm going to go with this.
I do.
You do. See, I don't even have to say it. That's how well connected we are. So let's talk about it, because there's talk that 6 feet isn't enough.
It probably isn't. There's the social distancing parameters are based upon technology that was from the 1930s. It's really old stuff. We already have some pretty good proof that when you put a patient in the hospital, you can find coronavirus particles alive and well in the ventilation system in the patient's room. So they didn't get up there and put it up there. It traveled. So the estimate now is at least 25 feet, maybe even longer than that. There's actually some studies where they did some high-speed video recording using laser particles that could detect particles down to like 1/100th of a micron, and people just talking within a few feet of each other are covering each other with particles. No sneeze, no cough at all. So the social distancing is probably much better than nothing. 3 feet is better than no feet, and 6 feet is better than 3 feet. But don't kid yourself into thinking that 6 feet is going to protect you 100%. You still need to deal with the hand washing stuff. And there is another portion of this thing, and that's the viral load. getting a little smidge of coronavirus is not nearly as bad as getting a bucket full of coronavirus. So there is a certain amount of load that works. And one other sort of off-label use we could talk about briefly, because it's been in the paper. There's been 2 drugs, one called losartan, another one called telmisartan, that have been talked about being used to prevent the coronavirus in the first place.
Isn't that a heart?
Yet.
Is that a heart one?
Blood pressure medication. Those are blood pressure medications, and what they do is, it just turns out those 2 and several others similar to it bind to the exact same receptor that the coronavirus needs to get into your lungs. So in theory, if you've got that particular blood pressure medication on board, maybe it will block the coronavirus.
That'd be great. That's what my wife takes.
So the issue is, if you have high blood pressure and you're on losartan or telmisartan, maybe don't stop taking it. There's another theory that when you take that medication, it does something called upregulation. It makes your receptors more voluminous, more of them, more sensitive, and maybe increases it. But we have no data to say that people that are on those meds have an increased risk. And as it turns out, women have about twice as many of those receptors as men, and yet they're not getting twice as many women getting the disease. So it's unlikely that upregulation is really an issue here. It's also not clear if it'll actually work. So people that are on telmisartan or losartan should probably continue to take it. People who don't have high blood pressure, it's hard to say if taking it's a good idea or a bad idea. If you take somebody that's small and has low blood pressure to begin with, and give them even a low dose of a blood pressure medication, they can get dizzy, fall over, and break a hip. And that can be fatal. So it's not obvious if everybody should be on these medications or not, but that study is being done too, and in about 4 to 6 weeks, we will have a pretty good answer about whether or not it makes a difference.
So you talked a little bit about women, men. Let's talk about age groups. You know, obviously they've been speaking about the elderly, more susceptible to it, but my sister-in-law, who's a nurse at a hospital in New York, told us a 10-month-old came in with it. What is the studies that have been done on that? And if someone that is 10 months old, is it as dangerous as someone that's 70 years old?
It's really not so much the age as it is the susceptibility. The elderly sometimes just aren't as tough as the younger people are, but that doesn't mean we don't get 22-year-old marathon runners getting it too. So if you look at large populations, you can say the older you are, the more likely you are to get it, or the younger you are. So the really young and the really old tend to have fragile immune systems. People in the middle have less so, but it doesn't
discriminate.
There's plenty of people in all groups that will get it. And again, there's plenty of people in all groups that will get it and have no symptoms whatsoever. In the next several days to weeks, we're going to have another much more interesting test, at least interesting in my opinion. It's going to tell us within minutes sometimes who is already immune. Those are the people that can go out in the public and not spread it and not be affected by it. So that test is coming shortly, but it's not here yet.
So that leads us into another question, where they're taking the blood from people that have already had it and giving it to people that, you know, for, to be immune to it.
Yeah, it's called passive immunity. When you take the plasma of somebody that's already had the disease, in theory, they have lots of antibodies, which is why they're immune. You give somebody who's deathly ill a little bit of their plasma, assuming it's the right match, those antibodies will kill the virus in the person that gets the plasma. So that's an ancient kind of therapy, and it does work in some cases. It's not by any means the best choice, but it's about all we've got right now. So some of the deathly ill people on the verge of death on ventilators and ICUs and so on, they're getting that, and it's getting some good results. But you have a pretty limited supply of people right now that are immune. Now, in 6 months, in my opinion, most of the planet's going to be immune to this, and it'll be done.
That's what we want to hear. So wait, let's just rewind, because a lot of people, you know, I've talked to so many people that are like doom and gloom, or they don't even, they don't want to hear it. So you just gave them their biggest glimmer of hope right now. Say it just one more time.
In my humble opinion, very humble opinion, is most likely in somewhere in about 3 months, maybe 6 months, maybe a little more, most of the planet is going to have been exposed, and most of the people will build up their antibodies and be immune. So it will, not to burst your bubble or anything, some viruses do this little nasty trick called antigenic shift. That means that the antigens, which is what the antibodies latch on to kill the bug, they change on purpose to try to avoid the antibodies. So is it possible to get it again? We've already seen a few of those people that were positive.
I'm sorry, but you're cutting out. We can't hear you. That was a joke.
Can you hear me now? Very funny.
No, we have heard some talk about that.
Yeah.
Also,
people can get it twice, and we don't know if it's twice, 3 times, or 100 times, but some bugs do that. But for the most part, the current batch most people are going to be immune to it within a few months.
So what do you want to say to people? Because when I talked to you about coming on, I said I want to be careful because people are being inundated with information and they are getting really depressed. I mean, they're isolated. A lot of people are not used to being cooped up for a couple of days.
Well,
weeks.
you know, there's the cup that's half empty or half full. It's about how you look at it, I suppose. You get to spend some time with hopefully somebody that you like. I see all these funny videos online with, oh, I'm having a great time, and their wife is all tied up in the closet. But, you know, you take this opportunity to reassess your priorities.
I got to check that one out.
I'll send it to you. So most people are going to do just fine. Again, most of the people are going to do really, really well with this. And it's an unfortunate hit to the economy. People are talking about whether or not we need to lift the restrictions, the curfews. And the rationale is, you know, the virus is bad enough, killing maybe 1% of the people. Imagine if we didn't have any grocery stores at all, how many people that would injure? You know, many, many, many more. So there's going to be a trade-off. There's a balancing act here between how much of the economy can take a hit versus how much isolation that you can put up with. The reason that they call this thing the flattening of the curve. We can handle a couple million cases of coronavirus patients, but we can't handle them all in the same day. So the trick is to spread out the illness so that if you can't prevent it, maybe you can spread it out. So some happen now, some happen later, and it gets further down the road so that the ICUs and the hospital personnel and so on have time to ramp up and to take care of people. And then by the time the first wave of people get done, the second wave comes in and you still have your equipment, but we don't have 2 million ventilators right now. So we need to spread this out over time as much as we can. But on the other hand, you should feel empowered by the fact that this is not the kind of thing that just sort of comes to you through the air in most cases. You can prevent this. You can walk around outside, not when it's illegal, of course, but you can walk around, and if you wash your hands and keep your hands off your face, you got a really good chance of either not getting it or getting a very small viral load, in which case your symptoms are likely to be much milder. So I had one friend of mine, he couldn't get any hand sanitizer, so he literally went to the liquor store, bought 180 proof liquor, and he mixed it with hand lotion, and poof, he's got hand sanitizer.
So here brings up another one. There was a thing going around saying if you drink whiskey or bourbon, that would kill it too, that you would never get it.
Not in your mouth, but you don't inhale whiskey and bourbon, and that's the problem. Not going to work. But you can rinse your hands off after you touch something, and that might help.
And by the way, we don't want to encourage drinking, so, but that was another story that you heard out there too.
Yeah, it may work for hand sanitizer, probably not so good internally.
I want to ask you on a personal note, because I've been friends with you for a long time, and up until recently, you've still been seeing patients. It's just now, like, unless it's an absolute emergency, you've been doing the whole teledoc thing. And your brother is also a doctor. As I mentioned earlier, he works in infectious disease. You have a son. How are you personally handling this? I know Alan has family members that are really in the thick of it right now because they're in New York and New Jersey, right, Alan?
I have a sister-in-law, family in New York, in New Jersey, but yeah.
Yeah, I can't even imagine the stress load that they're experiencing. What are you feeling right now? Are you concerned at all? Because South Florida's numbers are continuing to rise. We have some of the highest numbers right now going on in the country, and those are expected to rise. So how are you handling it?
You know, it's a mathematical game. If I offer most people $10 million or a penny that doubles every day for a month, which one are you going to take? And most people say they want the 10 million. But a penny that doubles every day for a month is $4 billion. And this thing is doubling pretty quickly. So it is expected to overwhelm the entire population. Now, when I say overwhelm, I mean it's going to be everywhere. That means every person is going to succumb to the disease. Just a lot of people are going to get it. My brother had to self-quarantine for a while. He was mildly sick, and he wasn't even sure if he had coronavirus, and he's an infectious disease doctor. He was tested 3 times. 1 test came back negative. The other 2 are still pending as of today. So he's not sure, but he has patients that are sick that when they're really sick, you go in and you got to do what you got to do. The people that are probably the worst case are the ones that are taking care of the really sick people, the intensive care patients, the ones that need intubation. I think we should be giving those guys our masks. They need it bad. I can walk around without a mask, and if I can just keep my hands off my face, I'm pretty close to being immune to it. But the guys in the intensive care unit, they don't have an option. They have to get in there and do what they need to do. And if the hospitals and the staff go down, it's going to be a lot rougher because who's going to take care of everybody else? So we need to protect these people as much as we possibly can.
So let me ask you this question. I have and again, when these tests come out where it's a 5-minute test, it's a little bit different story. But I got a friend that had the symptoms, went to the doc. I think I told you about this a little earlier today. Went to get a test taken on Friday. She didn't have the results back. She thought it was going to be positive. Found out just today that it's negative. It's pneumonia she has. So it's not always going to be the coronavirus if you're sick. It could be
Well,
the
here's
flu.
the really rough part. About a third of those tests are wrong. And the reason it's wrong is the collection procedure is not pleasant. You basically have to take that swab, stick it up the nose all the way through the nose to the back of the throat, spin it and pull it back out again. And not too many people are actually doing it that way.
Really?
And the test, even when it's accurate, when it really is negative today, doesn't mean it's negative tomorrow. So your best bet, if you're a person, is simply to assume you have it, assume everybody else has it, and govern yourself accordingly. But that doesn't mean gloom and doom. Just do the careful things. Keep your hands off your face. Soap and water is readily available, and the coronavirus has virtually no protection against 20 seconds of foamy soap. You wash your hands, wait till the foams count to 20, and it's dead. So if you don't have hand sanitizer, wash your hands. Keep your hands off. If you can't get the little wrist buzzer, then get a piece of string and wrap it around your wrist and tie it to your belt loops.
And by the way, I got a great song I found last night for doing the hand 20-second. I saw it Gangnam Style yesterday on YouTube. Was awesome.
That's about what it takes. So, you can walk around and do whatever you want and like this, but don't touch your face. So that's what you have to keep away from. So, and, the handshaking is out. I mean, everybody's got to learn to do the elbow bump and, all that kind of stuff, or one of these, or put your hand on your heart and bow. Just no touching for right now.
So a lot of things I've been saying also is obviously social distancing is physical. It's not mental. So again, one of the things we want to reiterate is you can go outside. You just got to be careful of not going around people. You need to go outside. You need to get the fresh air.
Go outside. You got to take the trash to the front lawn or whatever you got to do. You got to do. Just keep your hands off your face. Keep it, 3 feet, seems a little bit too tight. 6 feet's probably still too tight. 27 feet's better, but that may be a little loose. So if you're going to cough and sneeze, cover your mouth. If you were sick, for God's sakes, isolate yourself for at least a couple of weeks. And if you have to go out anyway, put your mask on. Keep your sneezes and your coughs to yourself. But you should feel empowered because you make a huge dent in this thing. Just don't go out and touch your face. And again, if you have to touch your face, you take your hand sanitizer. And you put it on, you get it up good, and then you rub your eyes. Do whatever else you want to do.
Yeah, you got to get the thumb thing, and you got to get the nails and all the other stuff, right?
Well, as best you can. I didn't do a good demo here, but I don't want to waste this stuff. It's like gold. It's hard to get.
I can't wait for that video to come out on YouTube. We're gonna make him do that video. We'll come up with some little song or something.
Yeah, maybe I'll edit it into this thing right here.
Right?
Okay, that'd be good. Maybe Miranda can wash her hands while you start singing a song, and she's got to keep going until you quit singing.
Else you want to say, like, obviously people are going to ask you, what are you doing to keep safe? You obviously are not seeing as many patients right now. Like I said, you have a young son. So what are you doing to keep yourself?
Well, the main thing in the office, I'm trying to protect myself and my employees. We actually had one person actually had to come in the office today. She had significant belly pain, and we did a CAT scan and the abdomen and pelvis over the phone. It didn't show anything, so I didn't know what was wrong with her, and I couldn't guess anymore. So she had to come in. So when she comes in, she's a nurse. She put on her mask. She was pleasant enough to do that. When she comes in the room, I wash my hands because I had to touch the doorknob. Then I do a physical exam on her, and I wash my hands again. And then when I'm all done, coming back in the room, I had to touch the doorknob again. So I wash my hands again. So then we did the appropriate testing for her to find out what was wrong, but I needed to make sure she wasn't in a heap of trouble. So she's the only one that I had to see today. Everybody else, medicine is not a perfect science. If I have you in person, I'm probably 99.95% accurate. If I do it on the phone, I'm 94% accurate. So you gotta take what you can. So I can take care of most people pretty well over the phone. I've had a number of years of experience, like about 35 of them. So I'm pretty well able to, and I know the patients. I'm not seeing new patients right now. I know the patients, so I know who needs to be seen, who's in trouble, and so on. So as best I can, I protect them from each other. I protect them from themselves as best I can. And we still see the ones in the office. We do a lot of telephone consultations. And, I call my kid every night. His brother's in the next room or the next town. I'm trying to keep in touch. So I try to avoid the complete mental isolation. But this will pass. I mean, it's not going to last forever. We're hoping that the heat and humidity helps. I'm a little skeptical because it's in Mexico, it's in Dubai, and those places are hot and muggy. So I'm not sure that the summer months are going to take it out, but most bugs like this don't seem to spread as much. Maybe it's because people stay away from each other when it's hot and muggy and they huddle together when it's cold. Kind of hard to say why there's a seasonal variance to it, but we just don't know yet. And if it turns out that Plaquenil and Zithromax are a safe combination, we will know in a few weeks, and then we'll have a much bigger leg up on this problem and be able to treat people more effectively. We'll know if it's good for prevention, good for early treatment, good for late treatment, or what the situation is.
So I did want to ask you one other question. I know you mentioned before about the blood pressure medication, but get into vitamins, and just exercise in general. People say vitamin C. You got to take a lot of vitamin C to help you build your immune system. Vitamin A, vitamin D. Is there anything to that, or is that just normal? You should do anyway to keep yourself healthy and fight.
The most important thing you can do is sleep. Get 7 to 8 hours of high quality sleep. Your immune system resets at night when you sleep. Staying up all night long is a really bad idea for your immune system. So that helps. There is some suggestion that maybe zinc helps, but it's probably more topical. They had those zinc lozenges which completely disappeared off the shelf, but in order to use them, you have to melt them in your mouth and kind of gargle with them to let them coat your throat. So ingesting zinc and swallowing it is probably more fantasy at this point. It probably doesn't hurt anything. Some people are going to the extremes of getting 20 or 30 grams, which is a massive dose of vitamin C. And I just had a conversation with my good friend, Dr. Sai, who's a nephrologist, and he's saying he's seeing permanent kidney damage from such stuff. There's really just a really bad lack of proof that the high dose of vitamin C intravenously do you any good. I just read an article today that's talking about melatonin, which is a pretty safe item to take. It may improve the quality of sleep, and it's a pretty good antioxidant, and it may actually beef up the immune system. No proof whatsoever, but if you go online and look at melatonin coronavirus, you'll see some articles about it. So if you want to do something, that's fine, but sugar makes a hell of a beating on your immune system, so avoiding sugar is probably worth the trouble. Between avoiding sugar, drinking water, we have some pretty good data, not perfect, that artificial sweeteners are bad for your immune system. So sugar is bad, and so are artificial sweeteners, but water is pretty good for you. At least it's good water. Some people are all into this Kangen water or some of the pH. There's really no evidence at all that that does any good at all. Some people actually get sick from that stuff. But nevertheless, hygiene, rest, water, avoid sugar, do the social distancing as best you can, and above all, keep your hands off your face, and you are most likely going to come through this relatively unscathed.
That's awesome. Great information. I really appreciate your time. I'm sure you got a lot of people. I don't know if you're still working, taking calls, but hopefully this telehealth will be a wave of the future too, to help a lot of people out. I don't know what your thoughts are on that.
Well, it's going to change a lot of stuff. I mean, the planet will recover. I don't know about how much the economy is going to recover, but the planet will recover, the people recover. And at this point, these pandemics have been predicted by the military, by some dignitaries. Even Bill Gates gave a lecture in 2015 saying this was likely going to happen. But
I saw that.
So we also think that it's possible that a meteorite's going to hit Earth and knock us all out. So if you spend billions of dollars on a meteorite that never comes, you're going to get in trouble. So it's tough to know which disaster is likely to befall you. So this one seems pretty likely, and I think we probably have learned our lesson about not being so prepared for it. We need to be able to have certainly a lot of masks made in the United States, so we're not waiting for the rest of the world to give them to us. So that would help, and we'll get through it one way or the other, and hopefully we'll be better prepared for the next one.
Thank you so much for taking time to do this. I know you've been so busy, but you're the best doctor.
Did I pay you extra to say that?
Yeah.
Thank you very much.
Well, no, seriously, we've been saying it. You've been seeing posts all along, people thanking people who work at the grocery store, and of course the healthcare workers or first responders. So I want to thank you personally for doing everything you're doing.
I'm doing what I can, and I'm sure all my colleagues are doing the same, and we'll just keep on doing it until we don't need to do it anymore.
And again, we really appreciate, I want to say I thank you very much too, and appreciate all the work you're doing. The information you gave today is incredible, and hopefully we'll be able to pass it along to a lot of people. So again, we just want to say thank you. Take care of yourself.
My brother Gary sees us. Gary, hi, how are you? Say hi to Mom. Yeah, Jeff, that's my other brother.
And always, as I like to end my shows, I like to say, you matter. So
thank you very much for mattering.
So thank you, everybody out there. Stay safe and have a great day.
Do it again soon. See ya.
Yeah.
And that's a Real Convo, bringing hope and awareness to those affected by suicide and mental health.